minutes. Let some other people log in. So welcome to this edition of Cancer Prevention and Wellness. Tonight's topic is the benefits of massage therapy in an oncology setting. I am your host, Jeff Jaguar, and a couple housekeeping issues before we get started. The audience will be muted. This is not in any way to discourage you from asking questions of our lecturer. Those would be best entertained via the chat feature, and we will be monitoring that, but we do encourage your questions. This lecture is being recorded and will be on the Cancer Prevention and Wellness area of the Cancer Survivors Park website as cancersurvivorspark.org. This is sponsored by the Cancer Survivors Park Alliance in Greenville. Before I introduce our speaker for tonight, I just want to give a shout out to Max Vogel, who is taking the place of Laura Coleman-Nichols, who is usually behind the scenes turning the knobs. She is on a much deserved vacation, and Max is finishing his first year of medical school at the School of Medicine in Greenville, and has been a volunteer over at the Cancer Survivors Park and is volunteering around the upstate community. I think he has designs on becoming an oncologist, but he is also very attuned to integrative medicine as well as preventative medicine. So Max, thank you for your help. We are very pleased to have with us Dr. Ann Blair Kennedy. Dr. Kennedy is an assistant professor from the University of South Carolina School of Medicine, and she has appointments both in the biomedical sciences as well as the family medicine department of Prisma Health. She is the director of the Patient Engagement Studio, which I will want her to talk a little bit more in detail about. She's an accomplished speaker, writer, and educator, and has led an unusual path to becoming a professor at a medical school. She is also board certified in therapeutic massage and body work, and so is very much an expert in this field that she'll be speaking about tonight. So Dr. Kennedy, thank you so much for your time and your expertise and willingness to share that with us. And I will hand it over to you.
Well, thank you so very much. I'm very excited to be here. This is a great honor to be even asked to give this presentation. So yes, please ask questions. Happy to have that conversation throughout this talk. So why don't we get started a little bit? I like to start with a roadmap. So thinking of like the agenda of what I'm going to be telling you. So we're going to start with a little bit about me so you can understand how I got here. Then we're going to talk some about supporting patients. I then will kind of cover some of the latest research about massage therapy as a supportive therapy during cancer treatment, and then also massage therapy after, once cancer treatment has been finished. And that's all great, but if you don't know how to find a therapist, that wouldn't help you very much. So we'll kind of conclude and wrap it all up with finding a therapist near you, how you might go about doing that. So you heard a little bit about me, but I've had this very unusual path to get to being an assistant professor at a medical school. And it actually didn't even start with massage therapy. My first 2 degrees, my bachelor's and my master's, are actually in theater. So I've been a
Really?
director. Yeah. So I've been a director. I used to teach public speaking and theater and film appreciation at the undergraduate level. And then I got my first professional massage at that same time and was floored. And it really changed my life, because then 6 months later, after I got my first massage, I was in school. And I became a nationally certified and a state licensed massage therapist way back in 1999. I opened my own practice right away and had a very, very successful practice down in Lawrence. I had a great little wellness center right off the square, and I really loved it. And I was volunteering for my professional association, which is the American Massage Therapy Association, and had a fantastic time doing that. And then I started to really fall in love with research. So that's when I went back to school and got my doctorate. But I'm also grew up in a family of researchers. So this is one of my very favorite photos of the intersections of my life. This is my dad, who is a researcher, along with one of my students, who was presenting her research at the Collaborative Research Disparities Conference a couple of years ago. And so
You have to make sure we're all muted here.
我等会进去好了。
I'm sorry, Dr. Kennedy, go ahead.
that's okay. So again, this is my dad with my student, Victoria Tori, for many people who adore her, just talking about her research. But, you know, life is complicated. And when I went back to school, I was a mom. I started my first day of my doctorate studies the day that my youngest started kindergarten and my oldest started 2nd grade. So I went through all of my schooling starting in 2012 with kids right on the way. And I was actually commuting down to USC in Columbia while my kids were up here in the Great Court Greenville area, in the Lawrence County area at the time. And I finished up my work there. And as I finished up this doctorate of public health, it's an applied degree. So looking at leadership in public health in health promotion, education, and behavior down at USC in the Arnold School. I then came up here to the School of Medicine. I did a postdoc first in the Human Performance Lab with Dr. Jennifer Trulk. So that was looking at lifestyle medicine and physical activity around all sorts of different populations, and then was hired on as faculty in 2017. In 2021, I got an additional appointment in family medicine because that's where I do a lot of my work and collaborations with a lot of different colleagues there. But in 2016, as I was working on my postdoc, I also at the exact same time that it was starting was this patient engagement studio. Our original director of that was Peggy Wagner. And as she was starting it, she invited me to join. And I just fell in love with this because the whole reason I went to get my doctorate was because I wanted to improve massage therapy research. As a massage therapist, I was reading all this research and I wanted to apply it to my patients, but it wasn't always applicable. And I started to discover a lot of that was because massage therapists weren't included in the design or implementation of that research. Now, there are some that do that, but not all. But that was the whole reason I wanted to go back to school, was to improve that research from someone who knows how it's practiced. Well, I hadn't thought about the patients. So when I got up here to do my postdoc and I found out that, yes, stakeholders and patients can help improve research, you can actually include patients because they have that lived experience as part of the research team, that just blew my mind. So when it started in 2016, I started going to meetings, and lo and behold, 2 years later, I was the director of the studio. So that just kind of moved me through, and I've been working with that for a number of years. And it's just been a wonderful and fulfilling piece of my work. And my research is working with all of these, we call them patient experts, because they are experts at being patients. They know their conditions better than I do. I've never had it. Same thing with a lot of our researchers. They don't have the condition necessarily. And it really helps to have somebody who has had that help improve that research as it goes along.
Well, I can see that you've been very much of a rolling stone. Is your dad still with us?
He is, and he is retired, yet he still goes to his office at USC several times a week. He still publishes. He is an exercise scientist and an epidemiologist and just loves the work.
And is he happy with your outcome?
Oh, yeah. He was really happy when I went back to get my doctorate.
Right.
Yeah.
And just if you could elaborate the logistics of the patient engagement clinic. I know we're not on the subject at hand that people probably came, but it's just a unique concept that before we actually put research out in front of patients, that we get some feedback from said patients.
Absolutely. So this all started here. Our patient engagement studio started because of the founding of the Patient-Centered Outcomes Research Institute, or PCORI,
Right.
Because they were a funding agency, and they're non-governmental, but they're funded by the government. So their funding comes from money from Medicare and Medicaid. And their whole purpose was to improve health and healthcare for patients through shared decision-making and comparative effectiveness research to help patients make decisions. So back in 2015, before I even got here, the group, a bunch of leaders at the med school and then at Greenville Health System got together to figure out, well, we really like some of that PCORI money. How do we do that? They say we have to have patients at the table, and they looked around the room and had no patients. So that's how the Patient Engagement Studio began. The idea was, if we want to improve research and get it back to the people who need it, which are the patients, then we need to include them in everything from figuring out if the research questions are important to patients, all the way through to looking at analyzing data, helping interpret data, or even sometimes analyzing it. In a way, we help with data collection at sometimes and giving feedback from a qualitative standpoint. They can help with reviewing documents for researchers. We do that a lot. And also helping getting the information back out to the patient population, disseminating that information. So we work with researchers and patients throughout the whole, beginning through the middle, all the way to the end of the research process. And it's just been a really fulfilling thing. And if you want to know more about it, we do have a website. It's sc.edu/patient engagement studio, all is one word.
Okay.
And that's how you can find us.
And if you have a research that's being generated within your ecosystem, is this, if it deals with intersecting patients, is this a requirement that they go through this process or encouraged?
So researchers are encouraged for some grants and required for others. So if researchers are seeking funding from PCORI, they have to have patients included as stakeholders helping design and implement that study. That's what PCORI requires.
Okay.
There's other groups that are starting to head that way. So those with AHRQ, which I don't always remember what the acronym stands for. It's one of the big national funders, but they will partner with PCORI a lot. So again, you're going to need patients included.
Okay.
And we do compensate our patients on top of that. They are not research participants. They are experts. So we compensate them for their time that they are providing as part of this research team.
And I'll let you move on after this one, but is there a definite change in the direction some researchers go after the feedback?
Absolutely.
Yeah.
It certainly can change what they're thinking, and it can start with something really small all the way up to bigger pieces of, the way I worded that research question really might not be what patients are looking for.
Right.
The most tangible example that I like to share with people is we were working with a researcher who, this was during COVID, and her whole research was trying to figure out how much COVID infections are actually here in the state. And so they were going to be doing a whole, sending out up to 6,000 letters to, no, it was 30,000 letters to try to get 6,000 participants, if I'm remembering that correctly,
Yeah.
to people throughout the state. And they were like, how do we get people to actually open their letter? They're going to think this might be junk mail, and we want them to actually open it and decide if they want to be part of the study. And that's what they were coming to us. They're like, that was one of their things that they were looking for.
Right.
And I remember this discussion going on with these patients and them saying, well, you need to make it visible. So maybe you use an envelope that is a different color, like pick a blue envelope. And then every time you communicate, you're on a news show, you're doing an interview, you've made a social media post, remind them to look for the blue envelope. And now when you go to their studies webpage, it says they're right on the front, look for the blue envelope, which was stuff that we specifically gave them that they utilized to help get people enrolled in their study. That's the most tangible one that I come up with, because I have like this outside place that I can go to and say, oh, look, we did that. Isn't that great?
Well, I'll leave you alone and let you get back to your main topic, but it's just one of those things that I think people are interested in, the unique aspects of our local medical school and how we do it a little bit differently.
Absolutely. And if anybody's interested in potentially becoming a patient expert, we are always recruiting new people who might want to participate in this type of thing. And on that website that I mentioned, there is a place where you can fill out a form and contact us about your experience. And we're looking for all types of people and all types of conditions over the course of time.
And just as an aside, your kids look great.
Well, thank you. They are pretty cute. I think I'll keep them for now.
Yeah.
So you can find me on the socials a little bit. I am still on Twitter. That's where you'll find most of my stuff about science. If you are on Instagram and you're interested, my Instagram has very little to do with science. So you'd see more pictures about my kids, my cats, food. Those are the types of things. But if you're interested, that's where I am. So a little bit more, what is my research and my areas of research interest? Because I've had this kind of weird career, it kind of expands and goes into different areas too. So my main area of work really is around patient and stakeholder engagement and the science of that. How can we improve it? How could we get people to trust us quicker and bring more researchers in, as well as looking at patients' preferences in different types of areas in work. The other area that I do research around a lot is lifestyle medicine, but in these two specific areas of lifestyle medicine, looking at stress in particular and social connections. So how can we improve social connections for different groups, and what are those interventions? And with stress, I really am focusing a lot on healthcare professionals and the stress and burnout and resilience and different things that they work on there. But also I'm really interested in massage therapy interventions. In those I'm usually a co-investigator. I don't usually start those. And I'm also a subject matter expert that other researchers who are interested in doing this work will bring me in as that massage therapist to help give them the idea of this is how we practice. And so those results are great, but that's not actually how it works in practice. So to kind of give them a reality check sometimes. So that's kind of the area that I work. In these specific outward facing talks, it's always good to kind of give people your framework and where you're coming from and disclose that additional information so you can consider that additional piece of what might lead to bias on my point around things that I'm saying. So I am the chair of governance for the American Massage Therapy Association, which does come with a little bit of funding. I am the former executive editor and editor-in-chief of a peer-reviewed all open access journal that is for the Massage Therapy Foundation and the RMTBC, the Registered Massage Therapists of British Columbia. It's their official scientific journal. And I'm a board member for AID Upstate here, and I'm also a PROCORI ambassador. Several pieces of my funding have come from the Patient-Centered Outcomes Research Institute. I've gotten several grants from Prisma Health and also the Fullerton Foundation.
And what we just went over there is very important from the standpoint of this series. When you talk about complementary and integrative medicine, sometimes we get a little bit off the beaten track, and we just want to make sure that what we're hearing here is research-based and data-driven and peer-reviewed.
Yes.
So thank you for that background.
And I will be excited to share with you some of the newer research that's coming out around massage therapy as well. So I wanted to start with just kind of making sure we were all on the same page with what words mean and our definitions in moving forward with how that all can be applied in research. And if we're talking about supportive and integrative care, where are we really going? So when we're thinking about it, cancer treatment is hard. Going through it is hard, not just physically, but also emotionally. And we do have supportive and integrative treatments that can really help that. So looking at the research that we've seen, these are the areas that we know that massage therapy and other integrative and supportive care can be helpful. And not just massage therapy, other types of integrative treatments too. So we know that certain types of work can help enhance the effectiveness by reducing side effects or improving quality of life, can help with improving mental health, or even helping you feel like you're more in control of everything that's going on with your body, because sometimes it can feel like you've gotten out of control. It provides an additional avenue for social support, and it can really be personalized to help exactly what that individual is looking for. But getting into the specific definitions of things, this all comes from my dissertation work, actually, this next little section. And what I was working with this set of data that I had was from 45 different experts in the field of massage therapy who had decades and decades of experience. They had these long discussions and they were trying to create best practices specifically around stress and low back pain for massage therapy. So trying to create some clinical practice guidelines. But it was actually too early in the conversations to get there. And what came out of those conversations and what I found in all of those data was this difference around massage therapy, and massage therapy practice. Even though those words are used oftentimes interchangeably, they're actually very different concepts. So when we're looking at research and pieces, we really want to know what people mean when they're talking about a treatment. So for us, what we found, we've got to clarify what all of these things mean. So what is massage? Oftentimes people think it's just some type of soft tissue manipulation, where someone is just putting their hands on top of someone else's skin, either clothed or on someone who is clothed, and pressing on that soft tissue. But it's actually a little bit deeper than that. So what came out of our data is that massage is patterned and purposeful. So this was expanding upon the definition that was originally there. So the bold pieces of this were the parts that were added based on the data that we had. So it's this patterned and purposeful soft tissue manipulation with different parts of your therapist's body, their hands, their elbows, their knees, potentially, sometimes even feet, with the use of some type of oil or cream, sometimes heat and cold. Sometimes those are used, sometimes they're not, they can be. But the whole purpose is to change something therapeutically. The goal of massage is change, is what we're really going for. But that's different than what massage therapy is. And how do all of these things come into context? So when we start with this and we look at it, massage therapy starts, of course, with the application of massage, but there's also these health messages that come out. And massage therapists will talk about giving homework to their clients or patients. It's thinking about health promotion type pieces, but this is all within our scope of practice, We're not giving prescriptions. We're not giving, we're not diagnosing anything, but we can notice patterns within our patients and within our clients and help give some potential advice if that's something that they're looking for to help the treatment maintain over time. So that's our goal, is we want to help our patients stay healthier and pain-free over a longer period of time. And that's where those health messages come in. So it could be something like, I remember a lot of times people would tell me they would wake up with low back pain. So some of the questions I might ask would be things about, well, how old's your mattress? What position are you sleeping in? What's your pillow like? Those types of things. So then there could be some things that they could go home and test and try out to see if they could then feel better later based on some of those discussions we had.
Right.
So we start with that massage and health messages as the first part. But we also know that the outcomes of massage are going to be influenced with how the therapist builds that relationship and communicates with the patients, as well as their education level, the skills that they have, and their experience. But one of the more interesting pieces of this that really has not been studied at all is, what does the setting of where the massage is received do for outcomes? That has not been looked at all, because we know massage therapy can be delivered on a beach or in a hospital. And does that really change our outcomes? We don't know. Good.
Yeah, we talked about the, the kind of noise, the ambiance, the aromas, that sort of thing. And you mentioned the fact that it's not a conversation while it's going on. Not, at least not a conversation about, how's the weather. Okay.
There may be some conversation and communication during a session, but generally we're trained as massage therapists not to interrupt a massage therapy session with chatting.
Okay.
Is usually the way that I think of it.
If I could get my dental hygienist to do the same thing.
It can be a little bit difficult when your mouth is,
Right,
held
exactly.
open, right? Same thing when you're face down on a massage table. A little hard to sometimes have a conversation. So then what does massage practice look like? This was kind of the second piece that came out of our data, and I'm just going to kind of go through this quickly. But what we start with is massage therapy in practice is very much part of that biopsychosocial whole person health model. So thinking about the client or the patient being the center of everything. And it really starts with some type of assessment and evaluation of what is going on with the patient. How are they doing? What are their goals for treatment? And this even came to a place of, what does this treatment and assessment look like?
Was that Jeff? She gave us a frog pack.
Yeah.
You want to get your laptop right there beside you on the left.
Okay, you're gotta get muted.
Okay. So we usually start with finding out the client's health history and what are the goals that the client is stating that they're looking to achieve based on the treatment that they're seeking. And what came out of this was really that clients and patients are coming to massage therapy usually with one or more of the four following goals. They're looking to reduce pain, reduce stress, improve function, and improve improve well-being. And the way that massage therapists can figure out and kind of determine where things are in the beginning is by asking some specific questions. They can ask about the type of pain, the location, what it does for them, with the stress, getting their patients to rate their stress and describe how they feel that in their body. Then they can look at, where is the restriction for the function? What are those effects of a decreased functionality? And if they're an athlete or something like that, are they looking to enhance their performance? And then finally, they're sometimes just coming because they just want to feel better. And it's a treat for them. And they don't have any other particular goal. So it's just kind of like, where is their health state and how can we help that improve? So there's can be additional assessments in there, especially around function if we're looking at range of motion, looking at posture, and there's always potentially other testing methods that could be used as well. And then as the treatment goes on, then there's a potential for figuring out then what are the next steps? How are we going to evaluate that information and move into the next step, which is our plan of care. So that's moving into the treatment, then giving the massage therapy itself. And then we're going to reassess, like, okay, so if you started out with a pain of 8 at the beginning, where are you now that we've completed the treatment? Goals for treatment can also change right in the middle of massage, because you can be working on somebody's low back and they're like, oh, I didn't know that hurt. Can you do a little bit more work there? I remember that happening in practice for a number of years. Then we give those health messages that were mentioned before. We also really should, not all states require it, but many states do require us to document all of our treatments. And then there's always the closure and the ending of the session, and potentially rebooking and sending people on their way. But this is about how massage therapy practice is generally practiced and should be, according to the data that we had. And
So
these
the
are always
massage therapy practice, you're doing an evaluation, even maybe before you start,
absolutely.
but
You have
then
to do it before you start.
reassessing along the way
Yes, you have to do it before you start, or you don't know what to do.
through the session. Okay.
Yes.
And then reassessing based on, what their issues were. Do you ever bring up what's going on in your life? Is that something that makes people
Sometimes you
tighter?
do.
Makes me tighter.
Yes, sometimes you do need to find out that information, especially if you're wanting to depending on what the goal is, to prolong that the treatment effects is what you would be asking about. For example, if physical activity might be something that could really help, because we know it helps with pain, and we know that some type of therapeutic exercise might be helpful. We can ask if there is support in their household for them to be able to potentially accomplish that in some way. Not that we're telling them what to do or how to do it, but just kind of assessing that whole person piece about all of the things that are going to go into their health and well-being. And all of these pieces are impacted by the scope of practice in each state, as well as professional standards and ethics that massage therapists are following. So that's just to get us all on the same page about what massage therapy is and how it works. So now let's go into some of the exciting research that has been coming out in the last few years. I tried to get some of the most recent pieces as well to share with you some of this exciting things that are coming about that we're starting to see. So I broke this into two specific areas. One was specifically around when people are in treatment, and then post-treatment. So what we do know is that there's a lot of benefits and there's few adverse effects. What we've seen, I'll give you some specific examples here in a little bit, but what we see in the literature generally is that massage therapy is great for reducing pain, reducing anxiety and depression, helping with fatigue, as well as improving sleep and enhancing quality of life. To dive into some of the real particulars about this came from, the results of this are from a meta-analysis that was funded by the Massage Therapy Foundation, working with the Samueli Institute back in 2015, and this was published in 2016. Initially, they were just trying to do a meta-analysis specifically about massage therapy and pain, and they found so many pieces of research that they actually had to divide this into 3 different meta-analyses. They have one on massage therapy and pain in general, one on massage therapy and post-surgical pain, and then this paper here, which was on massage therapy and cancer pain. And this meta-analysis, which took a number of studies together to really look to see if massage therapy was effective in helping with pain from cancer. And what they found was when it was compared to active comparators, so something like exercise or acupuncture or conversation, whatever they might be, massage therapy was better than those active comparators for reducing pain intensity and severity, improving fatigue, and reducing anxiety. And what's so interesting about these mental health improvements is generally those are not within our scopes of practice to be something that we are specifically addressing. Yet that's what a lot of researchers investigate, is around mental health outcomes, which I always find very interesting.
You know, you had a picture there of what appeared to be a medical professional, probably a nurse, just kind of rubbing the scalp. Is there any program whereby, I mean, I know nurses, physical therapists, they spend so much time anymore documenting on their computer on wheels, and giving out pills, and just not having much in the way of the kind of interaction with patients that used to be part of care. Is there any capability that you all can kind of get nurses together to kind of teach them some simple techniques?
Well, massage is often taught in nursing school, from what I understand, and it used to be very specifically part of the work that they did. And the nursing practice has changed, especially in a hospital system. So yes, it'd be great to have massage therapists do that. I mean, nurses do the massage for patients, but would it be better to employ massage therapists to come in and provide that care, since nursing practice has changed?
Yeah.
Same with physical therapists.
Yeah, I don't think
Part
there's
of their scope.
a box on the Epic check box that says, oh, and gave massage.
Right. Not yet.
Yeah,
Working on it, right?
working on it. Yeah, got a lobby.
And it depends on the health system, and it depends on the state too. So there's certain pieces around that can be barriers or helpers for getting massage therapy into health systems a little bit more. So this is actually a paper that I was involved in that came out early this year, I think is when it was officially published. And I was contacted actually to be part of this team after they'd actually completed the study. So this is with a research team based out of Iran. And they used nurses who were trained by massage therapists to provide this very light massage on the back, just on the back, in these different dosing levels. So there were these 7 different groups. There was a group who got nothing. So that was our control group. And then there were groups that got either a 15-minute, 30-minute, or 60-minute massage 2 times a week or 3 times a week. And one of the pieces that I came in and brought to this project in particular, I'm like, because what they found was the higher the dose, the better the reduction of this symptom cluster of pain, fatigue, and sleep disturbance. So the more massage you got, the greater reduction you saw. Well, that's great, but not a lot of people have the availability, either time-wise or financially, to get 3 60-minute massages a week. So they also looked at the data and found that the 30-minute twice a week can still be pretty effective.
Right.
You might not get all of the benefits of getting 60 minutes for 3 times a week, but the 30 minutes was pretty effective for many people. So that one, I'm pretty excited about that. We don't have a lot of dose response research for massage therapy yet. So some other pieces about this is there actually are clinical practice guidelines for medicine coming out that include massage therapy. This is a recent one from last year, from 2022, specifically recommending when massage might be helpful for pain management in oncology in particular. So this one is specifically saying massage could be offered to patients experiencing chronic pain following breast cancer treatment. And the other recommendation is for massage to be offered to patients experiencing pain during hospice or palliative care. And that's a great place to potentially integrate massage therapists more. We actually have a different group I'm working with. We're working on a narrative review of massage in palliative care settings. So that piece is coming forward. We're working on updating it. That group is mostly out of Virginia. And some of the older clinical practice guidelines, these were for breast cancer and lung cancer. Again, they're recommending massage therapy for a number of reasons other than pain, also looking at anxiety and stress, as well as mood disturbance and fatigue. Then also looking at part of this place to really come in as multimodal support for patients, or especially around anxiety and pain. These are just two of the areas that we could really be effective in helping to treat. And that's great to see all the numbers. Numbers are great. Numbers tell us a lot. But to me, it's a lot of it is what patients actually say. So these two quotes are from two different studies that were using a qualitative approach. So really trying to have those conversations and look for themes that would tell us what this type of treatment might do for patients. So I think it's great to know that the numbers can help show reduction in pain, but also to hear a patient say, my pain is gone.
Yeah.
I think that's pretty impactful. And it helps calm them. So it's certainly a treatment and a therapy that can be very effective in a number of different arenas. Now, I kept this slide in from a past presentation. It's not specifically about cancer care, but it's something as someone who has a degree in health promotion that makes me excited. So massage therapists, when I'm thinking about health promotion, health behavior, and helping prevent cancer moving forward, massage therapists can be helpful because they're looking at large swaths of skin, generally, over a period of time when people come to the same massage therapist over and over the course of years. I had a client who came to see me weekly, every week, for over a decade. So I could watch to see if there was anything potentially that may change in some sort of skin lesion, in a mole. And massage therapists also feel like they have to tell the patient about it if they find something like that. They're not doing anything about recommendations for treatment in any way. They're simply saying, I think you might want to see your provider about this because I've noticed a change. So I think that's pretty great that is an area that we also.
No, it's not something I would have thought about, but yeah, clearly you are the one that can monitor them in places they're not monitoring themselves.
Exactly. Places they can't necessarily easily monitor themselves. I have several colleagues in the profession who will even ask to take photos with some type of, something that they can measure scale with, like even if it's just a dime next to it, and put it in their patient's chart to follow it over time. If there's something that they were potentially concerned about, of course, that was always with consent of the patient as well, but just to help them with that too. So I think that's great. So after cancer treatment, what do we see in the literature? So this is some of the pretty interesting things that have come out of it. And there will be a new study I'll kind of go into that just recently came out about improving chemotherapy-induced peripheral neuropathy. Saying massage therapy can help with that. Looking at prevention and treatment of lymphedema, which can be a side effect post-cancer treatment. Looking at reducing, again, pain and stiffness, so improving that function, potentially also influencing scar tissue, improving that range of motion and flexibility, as well as, again, stress reduction and social support. So a lot of the outcomes are the same, but we get into some real specifics here about with cancer-related fatigue and chemotherapy-induced peripheral neuropathy. So this was a great study that came out of Emory with Dr. Rappaport, who was the head of psychiatry at Emory. He's not there anymore, I don't think, but he would work with the Atlanta School of Massage to help implement the treatments. And what they found was in this intervention that they were working on, they were only giving massage once a week for 6 weeks so they had these three groups. Where someone would get just a regular massage, a Swedish massage is what's generally called, Others would just get a light touch, not with the moving strokes. And then they also had a control group as well. And in this, licensed massage therapists provided that intervention. And we saw that massage therapists, or the massage that was provided, help improve this cancer-related fatigue that many of the patients were experiencing. This is this one just came out last year, and I'd been hearing about this for a couple of years as well. So it's pretty exciting that they had these different groups. So they had a group that was getting leg massage 3 times a week for 4 weeks. They had another group that was getting leg massage 2 times a week for 6 weeks. They had this third group that was getting head and neck and shoulder massage. And then they also had a control group. Did they have a control group? If they did, I didn't put it on here.
Yeah.
They did have massage therapists providing this intervention. The sessions, both the leg massage and the head and neck massage, were 20 to 30 minutes in length. And they did see the more you get it, the better you do. But for this chemotherapy-induced peripheral neuropathy in the legs and feet, even the head and neck massage improved that symptoms of that, which is fascinating. How in the world can head, neck, and shoulder massage improve peripheral neuropathy in the feet? Well, they think there's a systemic effect of the treatment. But I just love that work. I think it's just fascinating. We've seen some of the same things with working on the opposite side of, you might work only one leg and not the other. And you can see improvements in the leg you never even touched. So there's just some really cool things. We just don't have enough research about it right now to know fully what it can do. But it's great that you can get treatment in one area and really help improve yourself all over your body.
And I can tell you from experience, peripheral neuropathy is a huge issue. It's kind of the end result of a lot of our effective therapies.
Yeah. So if going and getting a massage can help reduce that, seems like something great that should be
That'd be great.
instituted into different programs. So another thing that we would often see that comes out of cancer treatment is lymphedema, right? This is actually one of the types of modalities that people generally can get in continuing education after they receive their initial education to go into practice, but also physical therapists, occupational therapists, and nurses can also go on and get this additional type of training. This is very light work. It's mostly working on the surface of the skin to help activate the lymphatic vessels, to help move the lymphatic fluid away from areas that are being impacted. And what they did find is that manual lymphatic drainage, or MLD, can be effective. There's still a lot more research that needs to be done on this, but it can really help people out. And it actually may even prevent lymphedema for those who have had some type of intervention that might impact that and lead to it. They're seeing that it may be preventative as well. But again, more research is needed. So that's just some of the exciting research that has been coming out recently, and as it's beginning to grow. And it's all wonderful, but how do you find a therapist? How do I know if somebody actually knows how to treat me and can treat me safely? Because I have had cancer and I'm a little worried about that. So here are my suggestions. Start with asking questions. If you find somebody, I'll give you some places where you can go and look for them. These are some questions that you probably want to ask when you're doing an interview with trying to determine if you want to make an appointment with a therapist. So first, you want to make sure that they're credentialed. Did they finish their education? And if your state requires there to be a license, do they have one? And they should easily tell you what their license number is. Mine is 2064. I can tell you that much. What are their professional memberships? Because that would also lead them to have insurance to cover any type of malpractice. You want to make sure that they have insurance. Do they have any special training specifically for working with people with cancer? That's not always specifically necessary because it is covered usually in their initial education, but it's something that you may be interested in finding out about, especially with the precautions around lymphedema. You want to make sure that they understand what goes into that and how they might best take care of you. You also want to know what types of things they have going on to help approach clients who have some immune being immune compromised. I'm not even going to try to say the big word at the moment. So how are they approaching that? How are they making sure that they can help those patients stay safe? And what is their level of experience? How long have they been in practice? In this profession, there's a real dropout of practitioners within the first 2 or 3 years. So if you have somebody who's been in practice for 4 years or longer, they're probably going to stick around longer. So those are just some things to kind of consider when you're looking for finding a massage or manual lymphatic drainage therapist. So where can you find them? As I mentioned, I do a lot of work with the American Massage Therapy Association, and they actually have a locator service. So if you just go to their website, it's amtamassage.org, or you could even just search, find a massage therapist. You'll end up at this place and you can put in your zip code and find somebody who has skills in your area. The Society for Oncology Massage, which is S4OM, is another group that also has a locator service or a listing of practitioners that have gone through their training. You can also look up the same sort of thing on the National Certification Board for Therapeutic Massage and Bodywork. Again, all of these places just have listings of individuals who have completed their training. For manual lymphatic drainage in particular, the final 2 bullets are the ones where you can find therapists there. So the Lymphology Association of North America, you can find a certified specialist there, as well as the American Lymphedema Framework Project Therapist Directory. So those are just some specific places you can go and find a therapist. So wrapping all of these pieces together, I told you a little bit about me and why I was here talking to you. You also got to learn about Patient Engagement Studio. Then we went into what massage therapy was, how it all worked together. And so we were all on the same page about what it was and what we'd be talking about. Then we talked a little bit about the newest research around massage during cancer treatment and when you're actively going through it, as well as massage therapy after cancer treatment. Then I finally wrapped it up with giving you some information about what you should think about when you're finding a massage therapist or an MLD therapist for yourself. And that is everything I have. Oh, look, I even forgot a slide, but there you go. So just to kind of bring it all together here at the end, though, it can be really valuable and a supportive type of treatment for cancer patients as well as cancer survivors. But you really do want to make sure that the person that you're getting is that you're going to be working with is qualified, especially to help achieve the goals that you're looking to have. And if you are looking to include massage therapy within your health and wellness routine, you really should talk to your provider about it. And they might have recommendations for you about therapists that they've worked with. If they haven't, you can provide them with this information and tell them, well, I heard this talk and this is where I thought I'd go find somebody and I found a great person and I want you to know about them. And then you can help that person's practice as well. So with that, if there's
Well,
any
Dr. Kennedy,
questions-
that was just a great, one of the things that we try to convey to our patient population, so much of what happens to them is just passive. Everything, they're on the business end of a biopsy needle. They're doing a mammogram. They're doing chemotherapy. They're doing radiation therapy. Stuff's going into them. This is a thing that they can do for themselves.
Yes.
Yes, they're laying there somewhat passively, but they're intervening with something that is healthy and supportive. So I think the field is ripe for all kinds of research studies. So yeah, your intersection with the patient engagement studio is going to be great. So just to let everybody know and to let you know that this will get disseminated further is that We have a patient list via all the hospitals in the upstate, and we'll send this link to where this is, the recorded version on our website, so that your helpful stuff can be shared with more and more people, and those people then share it with other people, and that's how the word gets out in this new millennia. So the chat was pretty quiet. One question I have: what any kind of occupational hazards with massage therapy? I mean, do you get arthritis in your hands? And
Oh, that's certainly a piece that can happen. And we are trained in our initial education about body mechanics and how to do that safely. So we can have a long career,
right,
but there are pieces that if you don't do that,
right,
yeah, you can really get some messed up joints and
oh yeah,
muscles. And it's a very physical profession.
right. And do you do anything to strengthen your hands? Do you have exercises or anything?
So I'm trying to remember what I did back in school. Now, mind you, I don't provide treatment anymore.
Right, anymore,
It's
right.
been a while, but it's more kind of like as you're in practice and as you're in school, you just start doing it so much. Now you can't always use like stress balls, and then you might sometimes see the little things that have the 5 little rubber bands, and you can do grip strengthening. But it's mostly just in practice with your education, because we were giving massage 4 days a week,
Yeah,
basically on each other. Let me tell you, massage school is great because you get massage all the time because you have to work on each other.
right, yeah.
We don't have standardized
on each
patients to
other,
work
right.
on.
Yeah, it's
We
not like
have to work
medical school.
on
We
each
have to
other.
draw
It's
blood
insane.
on each other. I mean, that's not so easy.
Yep.
Well, thank you again. I just have to do a couple of other housekeeping issues. Next month's presentation is going to be by one of Dr. Kennedy's associates, Dr. Beth Motley, in the family medicine area, but also in the area of lifestyle medicine, where she's a superstar, and she's going to talk about nutrition, whole foods, plant-based nutrition, which not only does she, an apple a day keeps the doctor away, not only does she teach this, but she practices that, and I can tell you her family practices that as well. And we will leave you with a short quote, and this is from Michelle Obama, and I think it's apropos to what we've talked about, and we need to do a better job of putting ourselves on our own to-do list. And so take care of yourself. Don't be hard on yourself. And we will call it the May version of this. And again, thank you for your time. And the future Dr. Vogel, thank you for your expertise as well.
Absolutely.
All right. Good night, everybody.